Welcome back to the Doctorate's Talk Show. Our next guest is here with us. Meet Yinka Obalaran. Yinka is a professor, and she's also a nurse practitioner. And she has been teaching for many years. Yinka, welcome to the show.
Thank you, Dr. Leslie.
We're glad you're with us. Our first guest, Pat, just told us that it is dangerous in the emergency room. Now, you may not be an expert in the emergency room, but I know for a fact that you have been a professor and you've taught many students. You've had many students throughout different hospitals doing their practicum, doing their internships. And so I want to find out from you, are you experiencing the same problem in the different areas? Is it, should I just say it's the emergency room? Or do you want to let our audience know that this is something that is standard throughout the whole hospital and not just the emergency room? What is your take on that?
Thank you, Dr. Leslie. Emergency room have been crowded, and the patient from emergency room transfers to the floor. So this is not only problem with the emergency room only, it's the entire unit and the hospitals.
That is appalling, because from what Pat just told us, it could not get any more dangerous than the way she expressed it to us. So if you're telling us that it is as dangerous throughout the hospital system or the hospital floors, then that is very concerning. Is it not, Dr. Tikam?
Absolutely.
So why do you think it's dangerous on the floors? Now, when we talk about the floors, explain to the audience, what do you mean when you say it's dangerous on the floors? What floor are you talking about?
Okay. The major concerns I really have with the patient is related to the patient quality care, in which you probably discussed. On the floor, patients don't get the quality care they deserve in the hospitals.
What?
And due to the staff ratios, the patient to staff ratios is very, very high.
Okay, so basically what you're telling us is that the quality of care in the hospital in general is very low because of the patient staff ratio. What is a patient staff ratio?
Okay, thank you. With my experience of years, over almost 20 years being a nurse, before I even became an educator, and even now as I teach and go to different floors, staffing ratio is very, very dangerous. What I mean by dangerous, example, I'll use med-surg example for you.
What was that? Med-surg?
We have med-surg. We have critical care unit, we have step-down unit, in which they call it progressive unit.
Okay.
That means when a patient comes down from the ICU, they step them down to progressive unit. From there, they might send them to med-surg floor before they go home.
Okay.
It's like a progress of the treatment.
Oh, I see.
However, my concerns is that the staffing ratio is so high that the nurses are unable to provide the quality of care that the patient deserves.
So let's make sense of this. The ratio is too high. So when you say the ratio is too high, there are too many patients to one nurse?
Yes.
So when there are too many patients to one nurse, does that mean that the standard is a certain amount of patients to one nurse? And when that is the case, then the patient gets better care or a higher quality of care because the ratio is good?
If the staff have low ratio, the quality of care, I'll use an example There was a time a patient was assigned to me. I'll use my example one day. And this was an ICU critical care. In critical care, this is a patient that are in critical conditions. So when you're supposed to have a 2-to-1, according to the ratio.
A 2-to-1 meaning two patients to one nurse.
However, this particular day, I was assigned to 3 patients. Wow.
Okay, so basically, to take care of a patient using good care or giving a high quality of care, if you're in the critical care unit, you can't have more than 2 patients, because otherwise you won't be able to provide the quality care that you're supposed to be giving those 2 patients.
That's exactly that's exactly what I'm talking about. Because
so does that mean that if you have, let's say you have 3 patients, you're a nurse in ICU, you're supposed to have 2 patients, now you have 3 patients, what happens?
Now I have 3 patients. Also, we have to take into consideration what are the acuities of that patient.
Acuity.
Acuity means the level of the stage of the high acuity of the how serious.
So that means that there are so many things to do for this patient, a lot of things to do for this patient, a lot of things to do for this patient, right. And you being one person, you can only take care of so many things for this patient and that patient, but not that patient. Does that mean that one patient gets left out? The care that other patient needs, that patient does not get. Is that what you're trying to say?
Exactly what I'm trying to say. Because when you have a patient in critical condition, you have 3 patients that are in critical conditions. How can you, one person, manage 3 patients in critical conditions? They are on the mark.
Let me ask you something. Does administration know this? Who should know this in the hospital? Who should be fixing this problem? Why would a nurse end up with 3 patients and they can't possibly take care of 3 patients in ICU? Doesn't the administrator know this? Doesn't the CEO know this? Doesn't the hospital system know this? Who is supposed to make sure, who is supposed to ensure that patients who enter the hospital get the care that they need? Who is responsible?
Thank you very much, Dr. Leslie. The administrators are aware of these issues. However, because of for example, if the sensors go high, there are some seasoning that the sensors increase. The sensors go high, we need more staff to work.
Census?
Yes.
Oh,
census means when we have more
when it's busy.
Busy.
Really busy.
So the administrative know that the managers, they're supposed to rent to hire new staff. However, they don't have a new staff. So they have to, the staff that are available have to manage all the patients. However, some patients get left out.
So basically, there could be a reason why they choose not to hire more staff. But the patients are the ones that is suffering.
Exactly.
How do you feel as somebody with a conscience, knowing there's a problem, knowing that you go to work on a day-to-day basis? Yes, you're not practicing as a nurse, you're a professor, but you are taking students, and the students are seeing these problems. How do you feel? You have a conscience, don't you?
Thank you, Dr. Leslie, because this is a big dilemma. We are training students how to take care of patients, how to give quality care. If we are teaching students how to give quality care, and they are seeing different things in the hospital setting, so
that's not a good thing.
No,
that's not a good thing. Why are you here today? Why are you choosing to come on this show and tell this to the public?
I am here today because I'm really concerned about the effect of this on the patient, how some patients have been dying for not...
Dying?
Yes.
I thought that only happens with the emergency room. Patients are dying on the floor also because there's not enough staff? No, that could not be. Dr. Tikem, are you hearing this?
I am hearing this, absolutely.
What's going on? You're a part of the healthcare system.
You know, this has something to do with money. Maybe you can elaborate on how money affects the care.
Well, I do not want to get my guest into this. This is just a topic that we're going to have to continue. And we've come to the end of our show. Thank you very much for listening.